Hello, everyone. Thank you for joining the Global Health Council New Member Orientation. We'll get started shortly.
Hi, and good morning, everyone. I just wanted to give a moment for everyone to join. We'll be starting in about 2 minutes. Thank you. All right, great. Thank you all for joining our new member orientation. We are so glad that you're able to join us today, and also wish that you and your families are staying safe, healthy, and most importantly, sane. My name is Haya Bagbassian, and I manage external engagement for Global Health Council, and I'll be starting off today's webinar. I'm sure many of you have been in touch with me via email or even in person during the member application process, and I look forward to working with you all this year. I'm also joined by my colleagues Kiki Kalkstein, our Director of Advocacy and Engagement, and Nyana Kwashi, our Senior External Affairs Associate, both of whom will be discussing more about their areas of work in this webinar. Please note that we'll be recording today's webinar, so if your colleagues aren't able to join us today or you'd like to refer back to this at any point, we've got you covered. We'll be sending out both the slide deck and the recording soon. Before I dive into the agenda and presentation, I wanted to pause and just take a moment to discuss some webinar logistics. Although we'll address questions at the end of the webinar, we'll be collecting them throughout the session and try to answer them throughout. So please feel free to insert your questions or comments in the chat box. So let's actually give a moment to test the chat box now. I'd love to know who is on the line with us today, and go ahead and enter your name and organization in the chat box.
Okay, and this is Kiki, just chiming in. It looks like everyone found the chat box or the question area. So thanks everyone for commenting there. It looks like we have participants from Georgia Bio, from the Hunger Project, Last Mile Health, Project Concern International, Research International, Global Impact. So great to have you all on the line with us today. If you have questions as we're going, you can feel free to drop them in here, and then speakers will either address them in the moment if it's relevant, or at the end of their segment. Thanks, everyone.
Thanks, Kiki. So we'll also be using the raise hands feature. I noticed a lot of participants were using that as well, so feel free to use that throughout our presentation. The agenda for today will be twofold. The first part of the webinar will be focused on who we are, along with the composition of our diverse coalition. And the second part will focus on what we do and, more importantly, how you can be involved. We'll also have about 10 minutes towards the end for a general questions and answer session so that you can hear more from us as well on that. So as we get started, we always start off with some logistics. There are some important member logistics for you to be aware of. First things first, we highly encourage our members to use our member portal. We have a membership portal through our Neon system on our website, and that can be directly accessed there. We want to ensure that you and your colleagues are able to access all of Global Health Council's membership benefits through that. And the way that we're able to do that is if your member portal is up to date. Each organization has one unique login, username, and password through the website. So this information is actually provided to the main point of contact on your account in your welcome email. So please save this information. If you are unable to access this information, feel free to reach out to us through our membership inbox, and also use this member portal to update all of your contact information for main points of contacts. We have we list all of our contacts for advocacy, communications, CEO for tailored emails or updates. So if those change at any point, please use the membership portal to make those updates. We also use the member portal to register participants for our many events. For example, the World Health Assembly, which is upcoming. We also use this to register for our events around our year-end Global Health Landscape Symposium. And we also have a feature where you can renew your Global Health Council membership towards the end of the year through this membership portal. So diving right into our history, you may or may not know it, but GHC actually has a very rich history. Since being founded nearly 50 years ago, the organization has gone through a couple of different iterations. During the late 1960s, US-based health organizations working in the field of international health realized that a lack of domestic coordination and collaboration was crippling the quality of health programs battling to save lives overseas. In many cases, efforts were being duplicated and limited resources were being exhausted. In response, a task force for international health was established in 1970 by the American Medical Association to identify and assess the significant hurdles facing US-based nonprofit organizations dedicated to international health issues. The 12-member task force, including representatives from US government agencies, universities and NGOs convene to examine the key issues and propose a system or body by which common practices could be communicated and shared among all organizations. As a result, the National Council of International Health was born in 1972. Most of the organization's early work revolved around coordination of its members in the larger global health community at an annual forum in which best practices were shared and members could network with each other. In the decade that followed, NCIH dabbled in implementing global health programs, expanded its membership base to different sectors and geographic regions, honed its focus on a few priority topics, maternal and child health, HIV/AIDS, and launched new advocacy efforts. In the 1980s and early 90s, mass globalization took over and healthcare became not just a remote concern of the developing world, but an issue with broad implications for the entire world. As a result, in 1998, the National Council for International Health was renamed Global Health Council, and a new president and board of directors were elected to fine-tune Global Health Council's focus on advocacy, building global alliances, and communicating best practices in the field. Global Health Council continued to grow in the 21st century, taking on more initiatives and growing its membership base. Unfortunately, in 2011, the organization was faced with some financial troubles due to declining conference ticket sales and a loss of a major funder, and was forced to temporarily shut down operations. During this time period, key stakeholders came together and decided that the organization, which had become a North Star for the global health community, was still very much needed. Less than a year later, the organization opened its doors with a new president and board of directors, a revitalized mission and vision, and streamlined programmatic focus. And this kind of fast forwards to where we are today, 2016 and present, where Lois Pace was appointed as the executive director, and the 2020 roadmap was established. And now, more recently, the 2030 roadmap was established, which we will be taking a deeper dive in just a few minutes. So this leads us to Global Health Council today. This is our current small but mighty team of 5. Lois Pace, our president and executive director, leads our organization's position and strategy and oversees all areas of our work. Our director, Kiki Kalkstein of Advocacy and Engagement, manages our advocacy work by convening stakeholders or partners around key global health priorities and engages decision makers on consensus recommendations. Myself, Haya Bagbassian, manager of external engagement, who leads our member outreach, community events, and special partnerships. I also oversee our resource mobilization and communications efforts for the Global Health Council. Our coordinator, Rebecca Daedalus, who is the coordinator of advocacy and community partnerships, assists with implementing our global health agenda and supporting the mobilization of our advocacy networks alongside Kiki. And finally, our senior associate of external affairs, Nayana Kwashi, who also works with me, supporting our communication efforts and coordinating member communications. She also manages our social media and assists with our community events. So just to let you all know who your points of contacts are in case you want to discuss specific work areas. The Global Health Council team is also supported by a number of global health champions who are a part of our board of directors and representative of our membership. Our board chair is led by Kate Dodson from the United Nations Foundation. Everyone's bios and more information is actually on our website and can be accessed there. What makes Global Health Council unique is our diverse membership. Our members span various sectors and global health issue areas. With a broad coalition, we're able to build very unique partnerships and brainstorm big ideas together. In blue, we have our global health advocates. And these are, not to be mistaken with our individual membership, which we had in years past. Due to the evolution of our membership model, we actually discontinued individual memberships and introduced the Global Health Advocacy Program to still maintain our network of individuals passionate about global health and taking action to amplify our work and mission. So you can see here that we are comprised of associations and coalitions, corporations and corporate foundations, implementing NGOs, contractors and consulting firms, academic institutions and think tanks. We have over 75 organizations at this point working in over 150 countries. To dig a little bit deeper, we are actually almost 50 or half comprised of NGO implementers and a quarter of comprised of associations and coalitions. We have 15% under the corporation and corporate foundation category, with 8% contractors and consulting firms and 6% academia and think tank. Our issues of focus range from environmental health, family planning and reproductive health, global health security, health systems, infectious disease, non-communicable diseases, neglected tropical diseases, policy and human rights, and other issue areas that we haven't even mentioned. Before I move over to our goals, I just wanted to take a moment to ask if there are any questions on what we discussed in the last 10 minutes.
Okay, but it looks like right now I'm seeing one question in the chat box that asks for clarification around the global health advocates. Anyone else, if you have questions, feel free to just drop them in the chat box and I will read them out for Hayab. Thanks.
So yes, our Global Health Advocates program is pretty much our individuals that are supporting the work that we do. I can actually send more information on the various levels. We have student levels, we have up to super advocate levels that consist of different access and different benefits. So I will actually follow up on this call and provide everyone with more information. But in the short term, you can actually access our website. If you go to join us on our website at www.globalhealth.org, there is a button where it shows Global Health Advocates, and you can actually get all the information there. All right, I will turn it over to Kiki to go over our goals.
Oh, and breaking last minute question coming in for you, Hayab.
Okay.
A specific question around the countries, and it's a question from Dines, and it says, I note that organizations are working in 150 countries, but For the countries that are not represented, what is the rationale?
Thank you, Dinah, for that question. We will actually circle back with the team and come back with an answer for that. These are countries that our organizations are working with under their scope, and we are actually working to expand to be more inclusive of various areas and regions. But I can circle back with an answer for that question with you directly, Dinah. Thank you for your question.
Okay, thanks, Hayab. I think I'm not seeing any other questions come through. So this is Kiki Kalkstein, GHC's Director of Advocacy Engagement. Really glad to have you all on the line with us today and have the opportunity to tell you more about Global Health Council and our work. And highlight ways that you all can be involved, whether you're a new organizational member or you yourself are new at your organization that has been a member for a while. So starting off, as Hayab mentioned, Global Health Council has launched our new roadmap through 2030, and this roadmap, while 2030 sounds a long time away, it's really, and we recognize that our work and priorities and scope may shift over this coming decade, is really just an acknowledgement of this new decade of global health that we are entering now in 2020. So we had our previous roadmap through this year, and then with the input of our members and other key partners, we have launched our new roadmap. Key to note is that our mission and vision really haven't changed. So those kind of core pieces of who we are as GHC, if you're familiar with us or have worked with us in the past, those pieces of our core business are truly the same. And you can see on the slide here, our mission is really to use this collective voice to improve global health and well-being. And then at the same time, the broader vision, our vision for the world is a world where health and well-being for all is ensured through equitable, sustainable investments, policies, and services. And our principles are really focused on leveraging the power of collaboration and collective action to inform and accelerate global health investments and sound policy. So it's both on the investments and the policy side of things. So these this mission and vision and the principles continue to ground all of our work, even as we look at our new roadmap. And previously, you know, the vision piece of the work was really highlighted on our vision around U.S. government engagement in global health, and focused on the vision of the U.S. government continuing to at least preserve or hopefully increase the annual budget for global health, really pushing the U.S. government to honor its international commitments to the UN and other agencies, and really ensuring that global health policy reflected not just current needs, but best practices as well. So that was really the core of kind of that vision piece of our work previously. And now as we are shifting and kind of building on that vision, you'll see on the next slide how we have this additional strategic goal that is not just complementary, but builds on and expands our goal and vision that was more solely focused on the US funding and policy environment previously. So this is the simple infographic of our new roadmap. And this one here just outlines the two very high-level strategic goals for us as an organization. And there is a more detailed infographic as well, if you want to check that one out on our website, that outlines more specifically the short-term and long-term goals that fall under each of these strategic goals. But for us, really, you know, we have this ongoing strategic goal around U.S. investment, as I mentioned. And at the same time, we have recognized that as we're looking at these big global goals around Sustainable Development Goal 3 and the UHC 2030 agenda, and really as we all seek to provide health for all, that there is a need for us to look at what GHC's role is in the broader global advocacy space, and how we can contribute to efforts to increase countries' domestic spending on health programs as they all are working to achieve UHC by 2030. So that second, that kind of additive strategic goal is really focused on that global space and at the country and regional level as well, with the aim of ensuring that civil society is really front and center in those advocacy efforts as we as a community are striving towards those goals. Great. So as you all are now members of Global Health Council, you know why these things matter, and I think that's probably part of why you and your organizations became members of GHC, and we're so grateful for that. So we don't need to, and we recognize that we don't need to convince you all why it matters. But part of what we're here to do together is really figure out all the best ways that we can convince others why global health matters, and why increased investments across the board and better policies are so critical. For us, it's, you know, we're at this really, how we see it is that we're at this really unique moment. There are these big global goals like, you know, working towards an AIDS-free generation, ending preventable maternal and child death, eradicating polio, and so many others. And these lofty goals are all really within reach, and there's so much that the global health community knows about what works and what will get us there. And now is the moment that we need to really continue to accelerate and excite folks to come with us in those fights that are within our reach. So we, you know, are looking to you all as our members about how to continue to bring in others to this work, because we recognize that none of us really can do it alone. And I think especially in light of the current COVID-19 pandemic, you know, we can all see how fragile progress can be in this space, and why substantive investments and improvements in health system strengthening and emergency preparedness and response is so critical. So for us at Global Health Council, we really, you know, we see that there is a need to do things a little bit differently, that we know what works, but as a broader global health community, that there are a lot of new strategies that we need to undertake to really bring others in around the urgency of this work. So we just are really excited to kind of to work alongside all of you as we enter this this new era of global health. Next slide. So how do we do all of that? One main way for us at GHC is the advocacy side of things. So we're advocating for sound, strong global health policy and resources. So how we do that is through everything you see kind of described in the bullets on this slide, which is coordinating broader funding asks and advocacy efforts through the global health advocacy community. Much of that is DC-based work around existing global health roundtables and coalitions. We bring folks together around educating policymakers on key issues, which includes our biennial, so every 2 years, our global health briefing book that we pull together as a resource for advocates and policymakers. We work with the broader community on messaging for public statements, on sign-on letters that can be addressed to policymakers on a variety of issues. We circulate information through and updates through our advocacy updates in our newsletter, and we really work to develop joint messaging for members on cross-cutting topics. And for us, this is really key. That a lot of times, and we've seen over the years how some specific health areas, health and disease areas, can be and remain very siloed. And we think it's really critical to ensure that there is cohesive messaging across different focus areas, and that we have coordinated conversations across those different silos. We also do our advocacy work through convening a variety of different member meetings with key stakeholders, including policymakers, whether that be on Capitol Hill or with the administration, and also with different UN agencies as well. Great. So the broader global health advocacy community, and this slide, or this list here of the roundtables that I already mentioned, and coalitions across different global health areas, this is also available on our website. But you can see here this kind of wide range of issues and ways to engage across the global health advocacy community. And these roundtables and coalitions are really the best way to engage in the DC advocacy space. So there are more than 15 based in the DC area, and Global Health Council leads around 5 of them, but participate for coordination purposes across all of these different roundtables and coalitions that are listed here. If you're not familiar with these groups, typically they hold monthly meetings, either in person or by phone, and the purpose of the different groups is really to set goals, do intel sharing, coordinate messaging and key policy asks, coordinate around different community events and Hill Days for advocacy with Congress, doing different sign-on letters to policymakers around key issues as well. So there's a variety of different activities that each roundtable undertakes on its own, and each of them have their own terms of reference and co-chairs. If you're interested in joining any of them, any of the GHC managed roundtables, you can email us and we can add you to their listservs. And for the other roundtables, if you're interested, you can either access the co-chairs point of contact and email addresses on that same page on our website, or if you'd like an introduction, anyone on the GHC team is happy to make that individual introduction for you as well. There are also opportunities for you and your organizations to have different leadership opportunities within the roundtables. If you're interested in co-chairing, coming into a leadership role, or if there is a specific area that you want to coordinate some activity on within a roundtable, then there are different opportunities that exist there as well. Next slide. Okay, so our Global Health Briefing Book. As I mentioned earlier, the Global Health Briefing Book is a resource that GHC pulls together every 2 years. And it is really meant to be focused for use by policymakers, and we have typically launched it at the beginning of each new Congress. So our last one was launched in February of 2019. And that launch included a Hill event and a variety of different meetings with congressional staffers and members of Congress across the Senate and the House to kind of walk them through what are, briefers on a variety of different global health issues. So includes some background that can be used to give individuals more information about a specific health area, and also includes specific asks that have been agreed upon and drafted by the different roundtables that I mentioned earlier. So as we look forward to our next briefing book, we will plan to launch our next one in January of 2021. So later this year, probably in the late summer, we'll launch the process for drafting all of the briefs that will be included in the briefing book. So if you're interested in being engaged in that process or learning more about how you can give input to specific briefs, keep an eye out for that launch and additional information from me, or feel free to reach out at any point. We are open to input on that. If you have looked at the past briefing book and have ideas about what would be useful in there, we are really open to any of your comments and thoughts about what's most useful in this resource. Next slide. Advocacy update. So I mentioned this briefly as well before. We share information with our members through our biweekly newsletter, and included in that newsletter is always an advocacy update. And that includes a range of different bits of information, whether it's updating folks on where things are with the appropriations process on the Hill, around new legislation that's been introduced or discussed or voted on. There are different Hill days or opportunities to engage in advocacy on other specific issues. We give recaps of hearings. And in this recent year, we've also included these updates to be not just from the US front, but also providing some global updates as well. So information on the WHO's executive board meeting and different convenings at the global level as well. We've provided updates within the newsletter in that way to push information out to you all. But again, especially as new members, we're really open to ideas that you all have about what information you'd like to see in those advocacy updates and what's useful. So feel free to reach out and let us know what you like, what you'd like to see more of, or any other feedback that you have on that front. From the broader messaging side, as discussed, we, GHC and how we see our role in the community is really to help coordinate folks on aligning messaging. So we do this through one-pagers and infographics and other tailored messaging, and some of that happens through the roundtable conversation and other places, but we do want to be a resource and a hub for some of that common language that folks can use in their work. So again, here you can visit the Advocacy Hub section of our website specifically for more information on some of that coordinated advocacy messaging. Next slide. All right, so in addition to the roundtables, we also mobilize around other key moments and bring our members together around key events like the World Health Assembly and our annual Global Landscape Symposium, to include, and also other broader international conferences and meetings like Women Deliver, the International AIDS Conference, and other big events where health advocates are coming together. We host periodic thought leadership events in DC as well, which includes our symposium and other smaller meetings on specific topics, as well as webinars. So there's a lot of different ways to engage there, and that will look different year by year. And I think especially this year, we're recognizing, and as things have been evolving so quickly with COVID-19, thinking about all the different ways in which we can bring our community together, whether that means a lot more virtual meetings this year, and how that will look. So again, interested in all of your input as we kind of think about what this period of time and this new normal for the broader community will look like, and what you may be interested in having different opportunities to connect through webinars or other virtual platforms. Do let us know, as we recognize there will be a lot less opportunities for some of the big, potentially a lot less opportunities this year for some of the bigger convenings. And I think the next one is my last slide. Great, and this last one I'll keep really brief. So one of those key moments that we typically organize and mobilize around is bringing a large delegation to the World Health Assembly in May in Geneva, and we've given GHC's official relations status with the WHO. We're able to bring a delegation of folks and have brought, upwards of 100 different members as part of our delegation to engage at the World Health Assembly to, meet with and give input to some of the resolutions and participate in those policy conversations, engage in side events, and all of those different related activities. This year, we recognize as a unique year, and we have been monitoring the status of WHA, and do not have official word from WHO yet about what WHA may look like this year, but are keeping close tabs on that, and whether the format changes or what other ways they will have for folks to engage this year. We will definitely keep you all updated. But needless to say, we are anticipating that participation this year may look different than it has in years past. Any specific questions? For me, I know that was a lot in those slides.
Yes, we actually have a couple of questions from our members. The first one is from Natalie Myers. And I think some of this you may have already answered, but when is the next biennial Global Health Briefing book? And what is the process of sharing it with congressional staff?
Oh, sure. Yep. Okay. So I may have touched on this right after you sent that, Natalie, but thanks for the question. So right now, our plan is to launch the next briefing book at the beginning of the new congressional session. So January 2021, we'll start our drafting process late this summer. So if you want to be involved in that, do let us know. And the process for the launch on the Hill is really through individual outreach to specific members of Congress and their staff who are on relevant committees to kind of focus that work, and also new members of Congress as well, recognizing that they may have not engaged on these issues previously, so really using that educational opportunity. So we ask for our members who are interested in participating in those launch meetings to sign up, and then we organize a whole Hill Day, assigning folks into groups and giving you a set of meetings to go introduce the new briefing book to those offices. So that will happen early next year.
Great. Our next question is, are health worker training topics under the Frontline Health Workers Coalition?
Yes, so we coordinate really closely with Frontline Health Workers Coalition, and they are much more focused on some of the technical and programmatic aspects around health workers and their role in health programs across the world. So that coalition is the best place to engage for specific materials around health worker trainings and other specific issues like that.
And we have our final question on roundtables. Will we get an email, or will our organization know the schedule for relevant roundtables? And if a roundtable is not GHC managed, what does that mean? Who manages it?
Sure. Okay, so for the ones that are not GHC managed, they typically have two co-chairs from two organizations. Sometimes those organizations are members of GHC, and they just, have the roundtable has existed on its own and continues to function that way, but we work closely with them. So you can either reach out to those individuals, co-chairs specifically, to be added to their roundtable, or we can facilitate an introduction if you would like. In terms of schedule, some of the roundtables are really regular in their meetings, and it's always, the second Tuesday of the month from this time to this time. And some of them are a little bit more ad hoc. So we don't keep a full external calendar of all of the roundtables meetings, since they do shift around some. But if you are specifically interested in any of the GHC ones, we can let you know when, whether that has a more regular meeting, if that time slot is already established, or if they're more ad hoc. For some of the other roundtables, it will just be information that you would need to get directly from those co-chairs. We keep some of that, but it does change depending on time of year and different activities as well.
Okay, thank you for that. I think that concludes all of our questions.
Thanks, Hayab. Over to you, Nayana.
All right, thank you, Kiki. Moving on, just to talk about more events that you can get involved in. Global Health Council actually puts on a signature annual event in Washington, D.C. towards the end of the year, and it is a Global Health Landscape Symposium. So last year, we actually held it in December, and we had around 200 attendees, and they mobilized to convene and talk about revitalizing the global health advocacy agenda. The theme of last year's symposium was democratizing global health, and as you can see, your hashtag is on the screen as well. So if you happen to go on our website, you can actually get access to the symposium report from last year's symposium, and it's actually filled with key takeaways from the discussions that we had during many of the sessions and plenaries as well. So, please be sure to check out our website for that, and we will be releasing information soon on when the next landscape symposium will be, but we highly encourage you to attend this event, and as members, you do get a discount as well. In addition to our in-person events, we also have webinar series as well. So you can visit our YouTube website, and the link is on the slide. there, but you can actually have access to some of the webinars that we've done in the past. For instance, we did a policy series around the World Health Assembly. We've done a storytelling webinar just to talk about how you as an advocate can tell your global health story as well. And in addition to that, we do have more advocacy webinars and other updates and more. So be sure to check it out on our YouTube channel. Another way that you can get involved as a member is through our communications channels as well. So one thing that you'd want to do is just show your enthusiasm for global health and, help us amplify that message. So we actually have several communication channels. So we disseminate a semi-weekly newsletter. So this comes out twice a month. And so as members of Global Health Council, you should be receiving that newsletter. And typically in our newsletter, we include our advocacy updates and additionally, member news. We have a member spotlight as well, and also updates from our CEO as well. And we also tend to disseminate member announcements and events of interest as well in the semi-weekly newsletter. In addition to our newsletter, we also have a blog as well, which is also accessible on our website. And in this, you can see our member spotlight. So about once a month, we tend to highlight a number of organizations for the year. And so if you are interested in being spotlighted, be sure to reach out to us to let us know about your interest. We actually have a spot open for May if you'd like to be highlighted, and also later on in the year as well. In addition to our member spotlight, we also do craft op-eds and have submitted in media outlets, as you can see, DevEx, Global Health Now, and even the Washington Post. And again, as we continue to move forward, we'll continue to have more op-eds as well. In addition to all of those communication channels that I've mentioned, we do have social media. So be sure to follow us on Facebook, Twitter, and Instagram as well. And as you can see, we also have advocacy tools and a calendar of events on our website and our job board. So I'll just go into those in a little bit more detail just to show you what our newsletter looks like. Here, this is what you'll typically see. Again, at the top, we'll feature news and events. We'll also have an advocacy update and a member spotlight. So again, if you are interested in being highlighted, please reach out to us as well, and we can work with you to get that published. And for our blog, we do, again, have the member spotlight. This is also where you can find our advocacy update. And really, it's just a place to get your work highlighted. So in addition to the member spotlight, if you have other pieces that you'd like to submit as well, this is really the place where it's hosted. And please email us at events@globalhealth.org. For our social media, we typically promote the work that our members are doing, and a great way to do that is to reach out to us at events@globalhealth.org. Please share your toolkits or any other key initiatives that you're working on as well, and we'll be glad to promote that. Right now we have Twitter, Facebook, and Instagram. And we also do have a LinkedIn as well. So we put the handles for our key platforms on there at the bottom of the screen. And if you go on our website, you can also get the links to all of our social media channels. Our key hashtag is Global Health Works. And really, we are trying to show you that global health works through our platforms. And to the right of the screen, you can actually see the screenshot of our Twitter as well. So we tend to put out especially a lot of advocacy updates and just a lot of member updates on there as well. We also do have an Instagram, which we recently rebooted as well. So we are trying to put more updates. And again, if you have, information that you want us to share out, please reach out to us and we will be glad to promote it. In addition to our social media channels, we also have our website, which I'm sure most of you have visited, but you can find it at globalhealth.org. And on there, you can find a lot of different resources. Really, this is a central information hub for you as members to just, find out more about, what we're doing, and also for us to connect with you as well. So on there, if you notice in the gray bar, you can actually easily access the member portal. And we've also, in addition to the member portal, we also created a page for the COVID-19 response as well. So it actually hosts the US and global response information as far as what we're doing around coronavirus. You can also find advocacy updates and other relevant resources on our website, as previously mentioned. And for members, we also recently sent out a survey just to see how coronavirus is affecting the organization. So that information will be uploaded soon on our coronavirus resource page as well. And we're always looking for ways to improve our website. So if you do have any tips or any ideas, feel free to reach out to us again. But really, this is how we can amplify the voice of the global health community by having you all, share what you're doing, and that way we can put it out. So thank you, everyone. And that's really it. Do you have any questions on what I just covered?
Hi, just giving us about 2 minutes to answer any questions. Any last minute questions on all of the presentation? All right, great. I don't think we have any questions, but if you all, come up with any at any point, please feel free to reach out to us. Our email contacts are actually on our website. So please definitely feel free to reach out. We will be sending out a PDF version of our slides along with the recording. So thanks again for joining us, and please stay safe and healthy out there.